Welcome to another segment, and today we have the esteemed presence of Dr. Raj K. Manchanda, the former Director General of the Central Council for Research in Homeopathy under the AYUSH Ministry, Government of India. Thank you, sir, for your presence today.
Thank you.
Now, to give you a little bit of background, today we'll be talking about homeopathy. And homeopathy was basically a practice that was established by Dr. Samuel Hahnemann, basically a German physician who established it in the late 1700s. Now, in the early 1800s, it was introduced in India, and since then has been sort of a controversial topic when it comes to mainstream medicine. Now, sir, considering its rather controversial beginnings per se, and them kind of resisting it because it did not fit into the normal norms of medicine as of the time, because technically it is considered an alternate form of medicine. Now, my first question to you would be, what exactly made you choose to go down the path of homeopathy?
I'll tell you that my family tradition motivated me to choose homeopathy as one of the path. After completing my high school, I had two options. One, to go to the engineering side, and I got admission in one of the very reputed college, Delhi College of Engineering. And then another option was homeopathy. Our family tradition was that right from beginning, we all were treated with homeopathy, and we had good effect of homeopathy. And my father was also a homeopathic doctor who used to practice as a part of hobby, not as a profession.
Yeah.
So that motivated me to join. Then my another issue was that I used to participate in quite yoga and other Ayurvedic activities in and around our family tradition, as well as our morning sessions in the park for doing exercise plan. So that all always motivated me to find alternative to conventional medicine instead of just going for the mainstream medicine. So then I chose homeopathy, and then here we are.
Very interesting. The first word you said was the word tradition. Now, my second question comes in the sense of tradition, in which how exactly are you going to reconcile the traditional principles of homeopathy with present-day medicine? Because it's more per se research-based or evidence-based. And one of the controversies that has followed homeopathy all these years has been there hasn't been sufficient evidence as to its effectiveness.
No, the fact is not this. The fact is somewhere different, Homeopathy was one, like Dr. Hahnemann. He himself was conventional doctor, allopathic doctor. He got converted to homeopathy because he was not happy with the condition of allopathic medicine at that point of time. So he gave the first way of how you can do human experimentation in homeopathy. So in that way, homeopathy was probably the initial system that talked about evidence-based homeopathy, evidence-based medicine. What we are now looking at evidence-based is that it is only randomized controlled trial. If a system is able to be verified, or a drug is able to be we are able to verify on the basis of randomized controlled trial, then it is evidence-based, otherwise it is not. But if you see the hierarchy of evidence-based medicine, the first is high-quality case reporting. So in homeopathy, we are having millions of symptoms related to several drugs which are otherwise also used in herbal medicine as part of mineral medicine for last n number of years in traditional medicine in Europe, in Latin American countries, and even in India. So homeopathy do have a solid database. Okay. Like we have one subject we usually teach to our student is repertorization. That repertorization contains data of about experiences as well as our drug proving, toxicological provings, all under one banner. And based on that, patients are treated. Now, if you look at the modern concept of modern pharmacology, what I look at homeopathy is that it is a kind of immunomodulator that can have possibility of immunomodulating a person who is having different kind of diseases and treat patients by immunomodulation. So in that way, homeopathy is also an evidence-based medicine. And there are several trials in homeopathy
Okay.
that has shown its efficacious and its effectiveness in different diseases.
Now, sir, you have mentioned that essentially it does fit into the whole evidence-based argument.
Of course.
Now, what exactly would you say is the actual obstacle for homeopathy being recognized as part of mainstream healthcare?
Homeopathy, if you see the global presence of homeopathy, homeopathy has a presence of in about 100 countries. And in most of these countries, homeopathy is part of the armamentarium of conventional doctors. They learned homeopathy as an additional skill for their patients.
Okay.
There are EPI studies, epidemiological studies in France, where they have shown that all those family doctors, those who have adopted homeopathy in their practice, are using less antibiotics, are using less quantities of antidepressants, sleeping pills, less anti-allergics in their practice. So in that way, homeopathy has an far-reaching implications, if you say, and it is already mainstream only for those who want to work in this area. If you just want to criticize, there is no end to criticism in any field of medicine. That's the thing,
That's true.
It is more, sometimes I see the controversy around homeopathy is a kind of a political issue, right from the beginning, even now. But it does not mean that homeopathy doesn't require research. What I feel that certain community of homeopaths over a period of time have focused more on orthodox model of homeopathy.
Okay.
And somewhere we have not modernized homeopathy in entirety. But now efforts are on within India and in many countries, especially in Brazil and Latin American countries and even in Europe, certain countries and many scientists are working in this field to modernizing homeopathy in a big way and following the tenets of natural medicine also.
Now, sir, you have mentioned the word research here. And if I'm not mistaken, globally speaking, I think you're top 3 researchers in the field of homeopathy.
Not three,
But
four.
now, my question now comes to this. Looking at homeopathy as it is in its present state, which particular areas do you think need to be focused on in regards to research in order to further validate it into mainstream medicine?
I'll tell you, primarily there are 2 strategies for doing research in homeopathy. One is to develop new medicines.
Okay.
If you have to develop new medicines, you have to follow all the modern parameters of undertaking first animal experimentation, then going for phase 1, phase 2 and phase 3 trials, and then clinical practice. But the other model is that we already have a lot of data in homeopathy. That needs to be improved first by using new tools like prognostic factor research and by doing further clinical research by out of clinical practice and then doing high quality observational studies and randomized control trial. So these are the 2 clear paths that we need to follow in homeopathy.
Now, sir, what, like in the recent years, basically you've seen the pandemic that happened, the COVID-19, etc., and obviously as of that particular time, everybody kind of like runs more towards allopathy, right? But now the question now comes in: what role would homeopathy play in regards to things or health crises like pandemics, and basically? As you have antibiotic resistance, that's another issue that is actually really present. But now my question now becomes, what role would homeopathy play in the world filled with health crisis?
I'll tell you, whenever there had been in the past any health crisis, homeopathic doctors have contributed significantly. Like during the time of Spanish flu, it is said that those who took homeopathy, there was less mortality and less morbidity. There are some case reports. Even during this pandemic, there are n number of research has been done by Central Council for Research in Homeopathy, even by Delhi government and many other organizations. And they have shown how homeopathy can also play significant role. Now, coming back, if we start comparing homeopathic situation with the vaccine kind of situation, so what I feel that in several universities where we have possibility of doing high quality multidisciplinary research, this field do require that kind of consideration. And these multidisciplinary teams of immunologists, clinical pharmacologists, and molecular scientists, they need to work together to find out more into homeopathy. So far, the data that is available is collected by medical doctors out of their patients, out of their real-time practice. So what we need to do is more investment into clinical research and basic research of homeopathy by the government, by the universities, and by the pharmaceutical industry.
Now, sir, you've mentioned that there are certain things you believe the government should be doing. Now, my question to you becomes, if you had absolute control of, let's take, for example, the Indian scenario or the Indian territory, what exactly or what policies per se would you enforce if and when it comes to homeopathy?
It's not that if I had. Actually, I was Director General,
Yes,
so I had reasonable control over the situation that what policies we should follow. So what I did and what I could do with my team in the council, and of course with the help of Scientific Advisory Board and this, what we could do, we could instill research-oriented aptitude in our students in different universities, in different colleges, because who knows which new ideas can come from which university. So we started our studentship schemes, our rewarding the postgraduate student, those who are doing good research work, PhD student. So that kind of work we did. But apart from that, we invested heavily in developing research infrastructure in India. So we could develop virology lab, we could develop good quality medical colleges, where with well-equipped research labs are doing drug standardization and basic research in different parts of India. So we have to work on both sides, on basic research side also and clinical research side. And I think we started a number of clinical trials, and many of them are being published and are already in public domain.
So, if I'm picking up correctly from what you've just spoken about, essentially for you, collaboration was kind of like a very important part,
of course,
during your tenure as the Director General. But now, if you had the opportunity to specifically work with a certain number of universities, what exactly would you be bringing in with your level of expertise? What exactly would you be bringing in to like help the collaboration grow, or help homeopathy as a whole, or its education rather, help it grow?
I'll tell you, there are two types of education situation in homeopathy in India, which are standalone homeopathic medical colleges. And there are different universities, they have homeopathy as one stream, conventional medicine and another, and then basic scientist and another. So what I feel, the research, the university, those who have multiple departments, multiple types of student and brain power in the form of faculty, in the form of post-graduation, doing both basic research as well as doing clinical research. So these universities can really brainstorm and can come out with the solution. And the council and the people like us can always try to help them, those to find out the right kind of project and right kind of investment. And I sincerely feel that many of these universities do have very admirable infrastructure, but that infrastructure is not being rightly used for research in homeopathy, which is possible.
Okay, so you've mentioned that there probably is a gap in the manner in how they conduct the research. Now, what do you think would be the correct manner to do research?
Correct manner is that in the universities, here I could learn that now you have developed a organization like Scope, that is an umbrella organization where all the heads of the departments of different verticals are talking, brainstorming. I think this is the manner one should work and take out good research project in times to come.
Okay. Actually, we're actually hoping, like we'll get a chance to collaborate with you more in order to bring about the vision you have for homeopathy. Again, I don't really want to take too much of your time, so I basically want to end this interview with more of an imaginative scenario.
Okay.
Let's say, for example, you were to have a time machine and you could go back to a point in time in history where you could meet a younger you. right? Now, as a younger you, you're basically an upcoming researcher, but now essentially you basically can be said to have the status of an emeritus in your particular field. Now as an established researcher, top 3 in the world, what advice would you actually give to a younger you?
Okay. So when I passed out from medical college, I had idea of more of a orthodox in homeopathy. Like I will work in one particular way, I will practice in one particular way, and that is the only correct way. But after seeing global situation and working and doing research, I think our young people, and even I could have been more open-minded. Open-minded means all types of researches, all types of working with all types of formulations, even single medicine, multiple medicines, and even innovating with the new medicines. Like there are so many discoveries on conventional side, so many molecules have been discovered. We could have done more research into those molecules. So younger me will think that I have to be more modern, more innovative in adopting the all newer technologies in doing research and treating my patients.
Well, I think I think in general, I believe a lot of young researchers or upcoming researchers rather can actually benefit from what you've said, because even in my field, which is specifically the field of law, we found that there's a lot of old ways of thinking about the laws. Unfortunately, with the world we're in today, there have been scenarios that have been coming up that were never there when the laws were originally created, which means an innovative way of thinking needs to be implemented in order to move forward in life. So thank you so much, sir, for being with us today.
So for young researcher, I would like to say that they have to be very, very open-minded. And they have, but it does not mean they need not to learn about the orthodoxy of art side of homeopathy. They have to learn everything. And then they have to use according to the scenario they are in their life.
So thank you so much, sir. And
Thank you very much.